Assalamu alaikum wa rahmatullah. I am Professor Mohammed Osman. I will start with you clinical surgery. And in this lecture, the first lecture I will tell you about history taking. History taking is a very important part because it is the one which will lead you to the diagnosis and then after that treatment. You introduce yourself to the patient since this is the first time you see the patient and tell him who you are and your job and what do you want from the patient. This is very important so that you will start your relationship with the patient. And then you ask the patient about the personal data, the name of the patient, the occupation of the patient, the home of the patient, the residence of the patient, and the occupation of the patient. The home of the patient is where the patient is born and raised up, and the residence of the patient is where he is living now. The home and the residence might be the same, but sometimes you will find the patient home in some village or some town, and now he is in another town in the capital in Khartoum seeking treatment, and he is living with relatives. So the resident is different from home, but sometimes he is born in Khartoum and raised in Khartoum, and now he are taking the history from him in Khartoum. So the resident and home is the same. This is very important because you need to record things about the patient. And just this slide, the axiom of learning, you know that medicine have so many branches and so many books. All of them, they are speaking about the medical science. So according to your final job, you are going to take from these books whatever is better for your job. If you are going to be a doctor, a nurse, a pharmacist, dentist, and these things, you have to choose and learn from this pool of books about what you are going to be. And this is very important because the way you take the information depends on how you are going to use this information. Building a good doctor-patient relationship. This is a very important thing because the disease of the patient is a secret, and he is not going to tell you about the secret unless he trusts you. So you try to build a very good doctor-patient relationship so that he will give you the secret and he will give you the details of the disease from which you can make a diagnosis and treat the patient. And even the treatment of the patient will not take your treatment unless he trusts you. This is a very serious and a very important thing. So you start with proper approach to the patient. You introduce yourself as I said before, and you tell the patient what you want from him and from her. Then make the history taking a chat, not police interrogation. Be polite and try to chat with the patient so that the environment will be nice and he is going to give you the information. If you make the thing like you are going to interrogate the patient like police case, like as if he's a criminal, this will not be a good start. Speaking clear, simple words that the patient understands. Because if you speak in medical language, the patient might not understand. The medical people understand the medical language, but even a university professor might not, if he is not a medical doctor, might not understand the medical terms, and he might understand in another way. So you have to speak in a common language according to the level of the patient. If the patient is illiterate, if the patient is not educated, you have to speak to him in the level of his state. Do not offend the patient by your behavior or words. You speak in common words, polite words. Don't say bad words to the patient or make bad gestures to the patient. Just this is from the communication skill you learned in the previous years. Direct contact of the eyes and body language and all these things, they use to them in history taking. This is a very important part of your communication skill. Do not frighten the patient even if the condition is serious. Even if you know that this patient has a very serious disease, don't frighten the patient. Tell him the truth, tell him the whole truth, but in a way that you are not going to frighten him. If you frighten the patient, he is not going to take your treatment. He will not allow you to treat him or her. So you have to be very careful in your wording and in your way of saying the words. And this is part of communication skill, and this is breaking bad news. If the patient has a very bad disease and you are going to break the bad news for him, there is certain skills of communication that you should use to give the information, the full information to the patient. And then you have to have full privacy to the patient. You have to have a curtain, and you shouldn't allow a lot of people to attend this history taking, because the patient might not give you the whole secrets if you allow many patients to stay during the history taking. Even the relative, very close relatives, they shouldn't be allowed to stay in the room. You ask the patient whom you want with you. Don't be with the patient alone. If you are male, don't be with a female patient alone behind the curtain, or if you are a female doctor, don't be with a male patient behind the curtain. Don't do that. They have to be third party. If you want to have the relatives as the patient, whom from the relative you want to be. Don't think that the girl will give you the full